The Emergency Nutrition Network, ENN, is an international non-governmental organization supporting nutrition practitioners across continents. Our vision is that every individual confronted by malnutrition has access to the knowledge, tools, services, and resources they require to meet their needs. Learn more about what we do from members of our community.
I am a public health nutritionist from Nepal. I've been working in this field for the past 17 years, primarily in Nepal with different organizations like UNICEF, World Program, UNHCR, etc.
I am Milka Jane Pica Mysteria, and I am a 20-year-old college student of Central Philippine University studying in Bachelor of Science in Nursing and one of the youth partners of ENN.
My name is Folake Samuel, and I'm a professor of community nutrition in the University of Ibadan in Nigeria.
My name is Gloria Odei Obin Amakong. I currently a lecturer at the Nutrition and Food Science Department, University of Ghana.
My name is Analate. I'm an adjunct professor at the University of Ghana. I was also previously former director of nutrition at the Food and Agriculture Organization of the UN about 4 years ago.
My name is Francis Bruno Zoto. I'm a professor of public health nutrition at the University of Health and Allied Sciences, specifically from the Fred Newton Binker School of Public Health.
My name's Megan Pollock. I'm with Save the Children US, and I'm a nutrition advisor on the team, supporting mainly our programming in West Africa.
Hi, my name is Astrid Klump. I work right now for ENN, Emergency Nutrition Network, as the Field Exchange Content Coordinator.
I'm Mary Corbett. I'm Senior Nutrition Advisor with Self-Help Africa, and I've been working with Self-Help Africa for the last 10 years.
I'm Kevin Phelan. I'm the Senior Nutrition Advisor from Alima. ENN is a crucial resource in the nutrition community. It's a go-to resource for a lot of interesting stuff that's going on in the nutrition community, especially on an emergency basis. You'll learn about the most up-to-date research. I know that when I was with MSF and now when I'm still with Alima, I go to them when we have things that we want to get out, whether we want to update on research like around the simplified protocols. I learned of the first qualitative research around family MUAC from ENN.
I have used the ENN website to, it's a one-stop shop for me to find some of those key resources. Most recently, I used it to learn more about MAMI, and it helped inform a proposal I was working on. And also looking at those links that were under the MAMI-specific part of the website really helped me learn more about the specific steps of MAMI and how to integrate it into a new program or an existing program.
I have always introduced ENN to my students because it gives us stories of what is happening in emergency situations, and particularly for things happening in Ghana, NADMO. I've always related the activities of ENN to what is happening in Ghana. So I would say the Emergency Nutrition Network has been very, very helpful. ENN has been very instrumental in the work that I do with my students.
And I think I've kind of followed ENN, and then especially when I worked with infants under 6 months and malnutrition for mothers and infants under 6 months in Bangladesh, where we piloted a project using the MAMI tool that ENN published. So that was kind of when I got more into contact with ENN. And I think already then, I really appreciated that I felt like I was just a new practitioner, and really the openness and willingness to support implementation on the ground.
My latest interaction with ENN was when I was selected as one of their youth partners this year. Engaging with ENN has influenced my approach into nutrition advocacy and youth engagement. It's gave me some points that I should focus my advocacy on evidence-based, And it is one of our lessons too in nutrition and diet therapy in nursing. So we must follow when doing our advocacy work, we must follow data driven and drawing insights from credible sources.
I always consulted ENet and learned a lot on programs. And I benefited from people asking questions. I usually followed their questions and responses to their questions. And we have experts who helped in responding to technical questions. I'm saying this because I benefited from ENN, the ENnet. I got ideas to do my research work. And I got connected to very important people who helped me to do my research work. So I must say that I have really benefited from ENnet and the communications that goes on. And I remember we even had a paper in Field Exchange, the magazine or the newsletter for ENN, and we wrote about treatment outcomes with children, how to detect children who have poor outcomes. When they come in, how do we determine that they would end up or likely would have poor treatment outcomes? So ENN is really an important organization for the community of practice for nutrition practitioners in the world. And I must say that I recommend this organization to people in the field of nutrition, especially the ENnet. Actively follow discussions and contribute to discussions. Share your experiences, and others would benefit from you.
I think one of the things that I've used the most is EndNet, where sometimes when a question comes along or you have this niggle yourself, like, I wonder if how could we maybe improve things both for us internally as maybe the organization where I'm working with or as a collective. One example was during the cholera outbreak in Lebanon. I kind of put a question out and got some really great feedback from peers all across the world, like somebody from Bangladesh who'd worked many, many years in a cholera hospital. And that was really useful. And I could then bring that to the cluster and like also share that like from EndNet, because it was really easy to I could share the link to my question.
I've known about ENN and the field exchange for quite a long time, actually. I think the first time I learned about it was during 2007-8 when I was working with UNHCR in the Bhutanese refugee camps in Chapait. And our senior nutrition advisor had visited, and she introduced me to that this is a wonderful resource. Back in 2018, when I was engaged as part of the Nepal 2015 earthquake response, working with UNICEF as a nutrition officer, and we had introduced, as part of a comprehensive response, we had introduced an innovative tool to promote as a nutrition social behavior change communication tool to promote infant yolk child feeding nutrition. We had done a small operational research as part of that and quickly written up something about the concept and the findings of the operational research. But then it wasn't quite what you would submit to a peer-reviewed journal. So remember, I think a lady from ENN was visiting Nepal at the time, and she encouraged, why don't you, this looks like interesting concept, why don't you send it? So We wrote something up, and then we sent it to ENN, and then they helped to refine that, make it more succinct, etc., and then it got published. There were people even citing it, and it gained some readership, I would say. Within the country also, as part of the multi-sectoral nutrition plan and community level activities, it was promoted by government and UNICEF.
We have been using field exchange for the past 8 years in the department, where we receive the subscriptions all the time. It is a resource that we give to the students to gain experience from different parts of the world about what is happening in nutrition, especially from the field perspective. Secondly, we also generate research ideas from it. And recently, one of our PhD students from Kano in northern Nigeria walked up to me and said she saw an article from Niger about nutrition, about mothers and children, and about food systems that she wanted to adopt. And we looked at it, and from there, we contacted one of the authors, who is from USAID.
If you have a nice piece of work and you see good results, it's so important that you showcase it and that you get it out to the bigger audience, and that hopefully somebody picks it up. If you publish in the ENN, you're comfortable enough or confident enough to potentially do something else. We have to be telling our story, and I think particularly because the emergency side has got so much focus over the years, but actually the development side of it is fundamental to really achieve progress.
In field stories, I think that was what was sometimes very compelling, because to hear about what people are doing on the ground and how they are actually making an impact on addressing nutrition. And for me, that was very impactful, because you see, it's okay to know, but to actually see it in action on the field and see the impacts that is being made, I think that is enough for others to take up, the whatever they have learned to other areas. So I think that aspect of ENN's work, of field stories, it's so useful, and I'll say keep doing it. Keep doing it. We need those stories.
You have heard from our nutrition community across the globe, from network members to field exchange authors. Our work is driven and directed by the needs of nutrition practitioners, policymakers, and researchers. Collectively, we aim to strengthen know-how and evidence to overcome malnutrition. To learn more about ENN, visit our website, sign up to our newsletters, and start posting on NNet.